They don't have to deal with reporting, disclosure, ERISA, HIPAA, any of this stuff goes away. That's what my concern. Secondly, employer can be penalized even if you do offer coverage. And this is covered on slide 43, and let's look at this. The second way in which a large employer may be assessed a payment is where it offers its full-time employees and its dependents the opportunity to enroll in minimum coverage, but one or more full-time employees has been certified to the employer by the government as to having enrolled for the month in a qualified health plan on the exchange with respect to which the individual is entitled to a premium tax credit or a cost-sharing reduction. So therefore, you offer your employees coverage. And they look at the coverage and say, I looked at the exchange and I can get cheaper coverage on the exchange. And in fact, the government's going to give me a credit if I go on the exchange. So therefore, I'm not going to do this. I'm going to turn down your coverage, and I'm going to go on the exchange and get that coverage because it's cheaper. So in that situation, the employer must pay an amount, but only for those full-time employees enrolled in qualified health plan where it's allowed a premium tax credit or cost-sharing reduction. So unlike the first situation, you're not taxed on every employee, only those that go on the exchange. And the penalty is explained on slide 44. Slide 44 says, the penalty is determined by the product of the number of the employer's full-time employees who do get a tax credit, who go on the exchange, times the figure, which is $3,000. So you're not penalizing everyone, just those who got an exchange. So what's amazing, even though you do provide coverage to your employees, you still could be penalized an amount for doing so. So therefore, in conclusion in this section, a large employer to avoid the excise tax on the employer mandate must offer full-time employees and their dependents the opportunity to enroll in minimum essential coverage, and that cannot have any full-time employees purchasing qualified health plans to which receive a tax credit or cost sharing on the exchange. And what the employer must do is offer its employees affordable coverage, which means that the employer must pay at least 60% of the premium, and the employee pays 40%. And the coverage is deemed to be affordable only if an employee's premium is not more than 9.5% of the employee's household income. And the first question you may ask yourself is, how am I going to know that? I don't know that information. Well, you're going to see in a few slides that starting in 2013, you're going to give disclosures to the employee, and the employee will tell you whether your premium is too high. So therefore, if a large employer fails to offer its full-time employees affordable coverage under a plan bearing at least 60% of the cost of premiums, the employer is going to likely pay an excise tax. And also, the employer must pay an excise tax if any of its full-time employees goes on the exchange. That's extremely important to understand. So therefore, you can be penalized if you don't offer coverage and even if you do offer coverage. Now, another federal mandate is covered on slide 47. And what slide 47 indicates the fact if you're an employer with more than 200 employees, there's going to be an automatic enrollment provision. And we're going to be interested to see exactly under what situations an employer can allow an employee to opt out, so similar to a cafeteria plan or to a 401k plan. And employees will be covered unless they opt out. And we don't know at this point under what conditions an employer can allow an employee to opt out of their plan. Now, starting in 2013, these are the new disclosures you have to give to the employees. You must provide employees information on new state exchanges, which will be established in 2014, a planned share of allowed costs, availability of tax credit, availability of free choice vouchers, and all this you must give to your employees in 2013. So you must give the employees the tools. So if they look at your coverage and say, you know, this is way too expensive, and I'm going to go on the exchange and get my own coverage. Now, in addition to that, there's going to be, starting in 2014, additional reporting that you, an employer, must do. So you must report whether the employees are offered coverage, length of waiting period, lowest cost option, and actuarial value. And this will determine for the government whether you're going to be assessed an excise tax or not. So they will probably send you a bill. Now, the first reporting in this area is covered on slide 50. Slide 50 says for the W-2 for 2011, you must report the aggregate value, the aggregate cost of the employer coverage. Now, the question I get was, does that mean that coverage is taxable? No. It just means that it's another box. It's going to report it on there. And again, the ADPs and other payroll companies will ask you for that information. So again, that's starting for the 2011 year, and that W-2 is given by January 30th of 2012. Now, one of the things that you must do is that for any individual, any employee whose incomes are at or below 400% of the federal poverty level, and for a family of four, that can be as high as $88,000. And if their employee contribution is between 8 to 9.5% of their income, you must give them an opportunity to go on the exchange and purchase their own insurance. And to avoid the penalty, what you must do is give them a voucher for the amount of the employer contribution. And let's say your employer contribution is $7,000 a year. That voucher must be for $7,000. They go on the exchange and they find a better deal for $6,000. They don't return the $6,000. They don't return the $1,000 to you. They keep it. So, one, you don't have to give this voucher to everyone. Two, if they shop and find cheaper coverage, they keep it. So again, you don't give this to everyone. Now, other changes are the tax changes. First of all, there's an excise tax on high-cost coverage. This doesn't kick into 2018. There's a 40% tax on very high plans. For individual coverage, it's $10,002, and for family coverage, it's $27,000. One of the few goodies is described on slides 53 and 54. There's going to be a small business tax credit, as this describes in 2010 to 2013, for any companies that have not more than 25 employees and an average annual wages of less than 50. The government will give you a tax credit of 35% of the employer contribution if you contribute at least 50% of the premium. Remember, these employers don't have to provide coverage. Also, for small employers of less than 10 or fewer with annual wages of less than $25,000, there's a full tax credit. And there's also a tax credit for tax-exempt small businesses.